Okay, well now we're at the bit of the agenda which, as Simon said, is incredibly important to all of us. I'm really proud and privileged to have 5 brave ladies who are going to share their experiences with us today. 5 ladies who me and the team have met along our journey. And so first of all, I'd like to invite Helen Calvert up to speak to us today. She's actually travelled up from down south to be with us. From Manchester. To be with us. So we're really, really pleased that she could be with us today. So.
Where's my clicker for my slides? Just lovely, thank you. Good morning. Thank you to Hilda Yarka for inviting me to be here today. Really excited to see Improving Me launching. I've been asked to start the patient story section of today's event, but my own maternity experiences did not actually take place in this area. I had my eldest son at home in Sale in Cheshire, but not the area of Cheshire we're looking at today, and my youngest at St Mary's Hospital in Manchester. But Hilda's asked me to speak to you today because I'm involved in a number of projects with maternity themes. And one of my key messages is how everyone can get involved with these discussions via social media. Improving Me has a Twitter account and a Facebook page, as has been alluded to, and hopefully there'll be lots of engagement around those going forward. But what's already going on out there? The great thing about social media is you don't just have to be involved in one thing. So it's all about collaboration and shared information. These are just some examples of campaigns, organisations, individuals who are talking about maternity on social media. It's really easy to jump in and share your experiences. You don't need to ask for permission. All voices are valued. And that very much goes for the healthcare professionals, the commissioners. You know, I'm not just talking to parents here. This is everyone in the room. Nowhere is this more true than in the MatExp campaign. MatExp stands for Maternity Experience. It's a campaign which was started by an obstetrician at Kingston Hospital, Florence Wilcock. She teamed up with Jill Phillips of Nutshell Communications, who has developed a tool called Whose Shoes. The Whose Shoes game is a fantastic way to facilitate conversations about maternity care by encouraging people from all different backgrounds to put themselves in each other's shoes. The MatEx workshops involve doctors, midwives, parents, doulas, the receptionists, anaesthetists, MSLC advocates, anyone who wants to join in. And the focus is on action. What can we actually do? The campaign has been so inspiring that it's now a national movement on social media, with lots of activity on Twitter, plus a website and a Facebook group. Anyone's welcome to join the Facebook group, post to the hashtag on Twitter. There's lots of blog posts and information on the website about who's involved, what's being done. MatEx was chosen to be one of the 10 NHS Change Day campaigns for this year. A group of us did a pop-up workshop at the recent NHS Expo in Manchester. There's a huge amount going on every day. It's grassroots driven. So it's driven by enthusiastic people just getting stuck in. And I'd encourage anyone with an interest in maternity care to have a look. So I said that my own maternity experiences took place in Greater Manchester, but in actual fact, I do have a maternity connection to Merseyside. My youngest son, David, has a congenital heart defect and was transferred to Alderhay Children's Hospital at 1 day old. He had his first open heart surgery at 5 days old and was 3 weeks old when he finally came home. Our experiences at Alderhay prompted me to start the hospital breastfeeding campaign on Twitter, looking specifically at breastfeeding support on children's wards. There's currently no baby-friendly pathway for children's wards, as distinct from maternity and neonatal. And breastfeeding support on these wards and in these hospitals can be patchy. I've cleverly omitted my website address from this slide, but if anyone would like more information on this particular campaign, the website address is heartmummy.co.uk. I hope that Alderhay is included in the work of Improving Me, as for so many families, that hospital is essentially their postnatal ward. Babies are admitted at days or even hours old. Their newborn checks are carried out there. Infant feeding decisions are made there, immunisations are given there, mums often have their postnatal checks there. Parents are in need of postnatal support for physical, mental and emotional issues. Babies may need to be registered, benefits applied for when they have not even yet seen the inside of their own home. When we talk about postnatal care, we imagine a maternity ward, home visits, perhaps a baby group in a children's centre. But we must remember that a lot of postnatal experiences are occurring in children's hospitals. For an insight into what that can be like, I would like to read you an excerpt from a blog post I wrote earlier this year, remembering those early days with David. Until I was 38 weeks pregnant, we didn't know there was a problem at all. I was planning a second home birth. Until I was 38 and a half weeks pregnant, we didn't know how serious a problem there was. At 39 weeks, we were told David has hypoplastic left heart syndrome, HLHS. It is non-life compatible. Someone reminded me of that phrase the other day. It gave me chills. We were given the standard 3 options. So we had the option to abort our child. And I'm glad we had that option, because my first thought on diagnosis was, I don't want this. We had hardly any time to decide which route we wanted to take. But on that Thursday at St Mary's Hospital, I learned what I had always suspected: I married the right man. Phil and I went outside in the fresh air, dried our tears, decided we could totally do this and give our boy a fighting chance, and we decided on the surgical route. A high five in the car park sealed the deal. The next day, Friday the 20th of September, David was born by caesarean section, and the next day he was transferred to Alderhay. I left hospital, I left St Mary's, having no desire to stay in Manchester when my baby was in Liverpool. I left the hospital in a lot of pain, with paracetamol and ibuprofen my constant companions. At Alderhay, I refused to engage with the healthcare team whatsoever. I had room in my head for 2 things: expressing breast milk and being in pain. That was it. If it wasn't a breast pump or a painkiller, I wasn't interested. The cardiac liaison nurse, the lovely Jill, who I'm now very fond of, insisted that the surgeons, anaesthetists and so on would wish to speak to both Phil and me. Not a chance, I said. Phil's sister Judith is our son's legal guardian, and she and Phil spoke privately to Jill. I've no idea what was said, but as far as I know, they had to first persuade poor Jill that I wasn't a battered wife under the control of my husband. I just genuinely had no interest in engaging with the pre-op process. They cited duty of care for my mental health, that was that. The nurses, once this had been explained to them, were amazing. One of them practically rugby tackled the poor surgeon to the ground when he approached our cubicle with me in it on my own. They wouldn't let a doctor near me. I only know this because Phil later told me. I didn't notice at the time. I didn't notice much. You see, there weren't any choices. There was finding out all about the risks and statistics and dangers, and then signing a form to say we wouldn't sue Alderhay if David died. But there were no choices. So why, in my state of shock, would I want to engage in this process? It was surgery or death, and that was that. On the day of the operation, Phil and I had 7 hours to wait. At one point, we sat outside the hospital, and I asked him, what outcome do we even want from today? And he said he didn't know. You see, we had seen stories about heart babies and the struggles their families go through. We really didn't know if we could face it. Our goals from the day of David's birth had been meet him, hold him, his older brother Edward to meet him, his older brother to touch him, stroke him, maybe hold him, and his grandparents to meet and hold him. Those goals having been met, which they were before surgery day, there was a large part of us both which was ready to let him go. It was all so unreal. And he wasn't our son back then. He was just a baby we didn't know who had turned our world upside down. And then Nurse Lindsay came in to tell us he was on ICU. He had survived. She didn't give me much time to take that in. To her, that was fairly straightforward. Most of them do survive the surgery after all, 70% we were given to understand. But I needed a minute. He had survived. It was like Dorothy stepping out of the black and white house into the Technicolor land of Oz. He had survived. There were no guarantees, no certainties, but we were being allowed to enter stage 2, the months between Norwood and Glen, the first and second operations. We didn't just have 5 days with this baby. We potentially had 5 months or even years to get to know our son. Then I was involved. Then I wanted to know what was what. Then I had opinions. I still had panic attacks and meltdowns and anxiety and depression and all the other glamour that goes with having a normal baby, let alone one with half a working heart. But I was back, me, not just some spectre living from moment to moment. There was a glimmer of a future. Now, all of that happened within the first week of David's life. This is absolutely a postnatal experience, and there will be hundreds of stories like that that need to be captured in this maternity review. Speaking of maternity review, I know everybody here today is aware that the NHS is currently undertaking a national maternity review. I was at their birth tank event in Birmingham yesterday, lots of innovations being discussed. There are numerous ways to respond to the consultation to get your voices heard. I run a private Facebook group for UK mums. We currently have around 1,700 members. As a group, we submitted a blog post to consultant midwife Sheena Byram detailing what we would like the maternity review team to know. I'm sure these themes will come up for improving me as this review gets underway. These are the concerns that ordinary parents express time and again, and they're issues that I feel are crucial to any overhaul of maternity provision. Just picking up specifically on collaborative working, we've used that word lots today already, which is great. We must remember to include health visiting services in this review. Collaboration between midwives and health visitors can make a huge difference to families' experiences, particularly now that a lot of health visiting teams are doing antenatal visits, and therefore there's crossover of care. So I hope that lots of health visitors will be engaging with Improving Me. So I wanted to close with some pictures of my own family. Here are my two boys, Edward in the red at a few hours old and David at 2 days old. And there's the three of us together. I couldn't find a recent picture of all four of us with their daddy Phil, but I like this sunny selfie. This is what maternity experience is all about, building happy families. We all have something to say about our own experiences, the best things about those experiences that can be replicated, and the worst things about those experiences that need to be eradicated. I'm really looking forward to hearing the stories today and seeing the progress made for Merseyside, Wirral, Warrington and West Lancashire. Thank you.
Massive thanks to Helen there, and I'd now like to welcome up Grace Woods to share her story with us as well.
Hello everybody. I'm here today through meeting a lady, Elaine Hanzak, who's in the audience there. Elaine is the author of Eyes Without Sparkle and a recently published book, Another Twinkle in the Eye. We met through our shared experience of purple psychosis. Meeting Elaine gave me the confidence to write about my own journey of purple psychosis. My book, Saving Grace, which was published in 2010, which is available to buy on Amazon as well, by the way. Just thought I'd get that in there. Elaine asked me, I'm here today really because of Elaine. Through meeting Elaine, she gave me so much confidence to talk about what happened to me, because mental illness has got such a stigma attached to it that people don't talk about it. And through meeting Elaine, she gave me the confidence to talk about it, not just to her, but to other people as well. So I think Elaine's amazing. So I just wanted to say that. Last month, there was a perinatal mental health conference in Manchester. And last month was the first time that I talked about my illness and what happened to me following the birth of my first child. On this day and this experience, I met a lot of amazing people who, like me, suffered from PP or postnatal depression. I found the day to be very emotional, bonding, draining, and reliving painful memories. but it was an inspirational, uplifting and uniting experience as well. At this conference, I met Catherine McLennan, who asked me here today to speak again about my experiences, and I also met Hilda Yarker as well. When you have a baby, no matter what age you are or where you're from, it's a life-changing, wonderful, magical, amazing experience, or at least it should be. But this isn't the case for everybody. I was 22 when I became pregnant with my first child, Ellie. I had severe morning sickness throughout my pregnancy that lasted to the very end. I was hospitalised and put on a drip several times throughout my pregnancy. Towards the end of my pregnancy, I had a rash all over my body that was so severe it looked like I'd been in a fire. Because of this, my pregnancy had to be induced, and what started was a long, painful, slow labour that lasted 3 days. I had a forceps delivery, an episiotomy, and a blood transfusion. I was sent home pretty quickly, considering my ordeal, and after a day of complaining that I felt very unwell, I collapsed in the shower. I was taken back to hospital via ambulance, and there they discovered that I still had some placenta in my uterus. I had so many stitches from having my daughter, and obviously the episiotomy, and then I had to endure a D&C to remove the placenta that was left. To say the experience of having my first baby was traumatic would be an absolute understatement. But little did I realise this was just the start of my problems. I would like you all to picture in your mind a freezing, snowy day in February, and a young woman, 2 days after delivering a baby, runs out into the cold in her underwear, barefoot and bleeding from giving birth, uncontrollably sobbing along a main road. It's hard to think that that young woman was me. Who would have thought that 9 years later I would ever contemplate another pregnancy or go on to become the proud, healthy mum of 3 children after giving birth to twins? When I look back at what happened to me, I actually wonder how on earth I got through it all. I really do. Going back to that cold February day, back in 2001, before I ran out into the street, I smashed up my house and everything in it. I was trying to recover physically from my awful pregnancy and labour, but I had no idea what was happening to me mentally, so I ran away. I was in a state of total confusion. I ended up in the local pharmacy near to where I lived and grew up, and the pharmacist, who knew me by name and knew I'd just had a baby, must have realised that something wasn't quite right. He literally scooped me up in his arms, closed his shop and kept me safe and warm, and somehow contacted my family. My brother Ben turned up not knowing what to expect, and came to my rescue. Nobody knew what was wrong with me. Nobody knew what to do with me. They just knew that Grace wasn't Grace. We returned to my home to find all my neighbours standing outside, a police car and 2 police officers standing outside my home. I remember asking my brother what all the commotion was about, forgetting that I smashed up my house earlier on and was loudly hysterical. I didn't realise that I was the cause of the commotion. I was acting completely out of control. A doctor was called, and it was decided I was in no fit state to look after myself or Ellie. I was sectioned under the Mental Health Act, and my beautiful new baby was taken away from me. What followed were 2 spells in 2 different psychiatric wards. I was then put into the care of professionals at Leighton Hospital's Mother and Baby Unit in Crewe. My baby was allowed to be with me, and with the help of the fantastic staff at the unit, I was supported to finally care for my baby. At this stage, months had passed and Ellie was blossoming into a lovely, happy, chubby baby. And I am so grateful to my family that they took photos of her, as I cannot remember those months or her changing features. It was decided that I needed electroconvulsive therapy. I had many sessions of this, and from the first session, my mum said a flicker of grace returned. With each session, people that loved me and knew me started to recognise and see the person that I once was. I cared for Ellie without as much help from the nurses, and I tried my hardest to be the mum that I set out to be. I was on my way back. It was a long road to recovery with lots of bumps along the way, and during this time, my partner left me. My life as I knew it before was never the same again. I lost my mind, my baby, my partner, and the first precious, special 7 months of my baby's life. I was angry, I was hurting so very much, and this bond that I was supposed to have with my baby had been affected. I cried so much, and then one day I sat down and assessed my new life. I looked at my baby girl as if for the first time, and I realised everything that I needed or could ever need was right there. And with the love and support of my amazing, wonderful, fantastic mum, who's here today with me, I couldn't have got through any of it without my lovely mum. But through my mum and my family and my friends, I started to become a good mum, and my life took on a new role and a new meaning. Me and Ellie battled on together, and by the time she was 2, I was off my medication, back in work, a busy mum, trying to regain control of my life again. The worst time of my life was supposed to be the best time of my life, and I felt like I'd been robbed of all the wonderful first times you have when you become a mummy. For a long time, I was embarrassed by my illness, and it's unbelievable to think that it was 14 years ago now. I am no longer embarrassed. I think of myself as a survivor of this terrible illness. It's made me a better, stronger person, and it's also made me a better mum. It was me and Ellie for 5 years, and I met unexpectedly my lovely new partner, Glyn, who's really embarrassed now. It was a happy time and positive changes for me and Ellie. And Glyn, having no children of his own, took on the role of stepdad, and we became a family. Glyn took to this with a lot of love and ease, and it was nearly 5 years later that we discussed seriously about adding to our family. Glyn knew what I'd gone through having Ellie and knew all the risks involved. I never wanted Ellie to be an only child, and I always wanted more children, but I was absolutely terrified. As much as I wanted more children, I had to think about the child that I already had. And the thought of Ellie seeing me go back to the condition I was in following her birth frightened me so much. We talked a lot until one day we made the decision we wanted another child, and I got pregnant pretty much straight away. But then it all became real. I will never forget the day we took the test in the kitchen. So many emotions, but fear being the one emotion I remember most of all. We made a complete plan of action and a what-if plan, and having been through PP once before, my experience heightened my awareness and everyone around me. To find out I was actually pregnant again was nerve-wracking, exciting, and very scary. But to then find out on the scan I was expecting twins, added to the emotion and stress of it all. I literally fell off the couch mid-scan, I really did, in total shock. My mum said I never do anything the easy way. There was a bigger chance of complications and another possible episode of PP to think about. But my determination and plan of action were going to prevail. If this illness were to strike again, I was going to be super prepared. I took lithium as a preventative method from the 6-month stage of pregnancy, and I had regular blood tests to check my levels were accurate and my babies were doing well. In my plan of action, I found experts in this field and I chose my hospital. Everything was set up, everything was prepared like a military operation. Everything was in place for the arrival of our new babies and support for Glyn and Ellie in case of the worst case scenario. I felt settled and secure in the knowledge that if the worst happened, I would have enough support and love to get through it all again. I did for a while feel like a ticking bomb. And as the due date got closer, my anxiety grew. I don't know if it just didn't happen this time around or if the lithium helped. If I'm honest, I can't be sure. All I know is that this time it was completely different. On the 5th of May, 2010, I gave birth to 2 gorgeous babies, Thomas Paul and Maggie Sue. And through all the love, support and preparation I had around me, I didn't become sick. Even though it's 14 years ago now, I can still remember a midwife telling me to pull myself together when I was hallucinating or not making any sense. I also remember another midwife telling me to get up, get off the bed, hold your baby. You won't have a midwife when you go home. I remember feeling rushed to go home and a rush to care for my baby. I'd had a blood transfusion and episiotomy and a very traumatic long labour and birth. I was sent home with placenta still inside me. I had everything telling me that I didn't feel myself, that I felt unwell. And yet I could not communicate this to anyone. I personally felt like I was on a conveyor belt and the next person in line to have a baby was next. Sorry, I said that completely wrong then. And the next person to have a baby was next in line. Sorry, I said that wrong. I didn't feel personally like I was important or cared for. And even after everything that happened the first time around, I prepared for every eventuality or outcome with the twins. And yet there was still one midwife who urged me to breastfeed my twins. She hadn't read my notes or realised I wasn't allowed to breastfeed because of the antipsychotic drugs I was taking. I'm not standing here slating or hating midwives or health professionals. That's not the case at all. I have met some fantastic health professionals, but I've spoken to several people who've had bad experiences like myself. This has got to change. Yes, the NHS is understaffed. I understand this, and the budget is overrun, but midwives and health professionals are in the business of making memories. Things need to change so that people have lasting good memories of bringing their children into the world with the feelings of being cared for and looked after well. Thank you.
Thanks to Grace for that very heartfelt story that she's shared with us today, and great to see her mum and her partner here to support her too. I'd like to invite Monica Wright and Kim Harrison up to the stage now. They're going to share their stories with you. Thank you.
Hi. I come to this from a slightly different angle. I'm coming from the fact that I've had a really bad experience and I felt empowered to turn my bad experience into changing and shaping services for future mums. And to understand, obviously you can tell from the accent that I come from Scotland. We have a very different NHS service and a very different maternity pathway in Scotland. So when I came to England, I knew nothing. I thought it's the same as Scotland. I go to the doctor to tell me I'm pregnant, they send me to antenatal classes and I have a baby. That was how I came to England. But I moved to England in 2009 to live with my now partner Stephen. And not knowing at the time I was 10 weeks pregnant. Unfortunately, my first experience of maternity services was when I lost that baby at 10 weeks. I went to the hospital, I was sat in a room full of heavily pregnant women while I was sitting there knowing that my baby was no longer there. To me, that's the hardest thing I've ever done, and I hope no other woman who ever suffers a miscarriage has to sit in a room full of pregnant women, happily showing their partner scans, talking about names, talking about, I want a home birth, I want this, I would like that. It shouldn't happen when you've suffered a miscarriage. I know people are happy, maternity is a happy experience, but when you're that parent sitting there and your world has just ended, you don't want to be sitting listening to things like that. However, I thought for me that was my last chance to have a child. I was diagnosed at the age of 7 with a connective tissue condition called Ehlers-Danlos syndrome. When I was diagnosed, it was relatively newly known in Britain, and a lot of people used to call it severe hypermobility. I was told at the age of 7 I would probably never have children. Because of my connective tissue, I may not have a uterus or a womb strong enough to hold a baby. So for me, I had lost that chance with that baby. However, in Christmas of 2009, I went home to Scotland with the best present I could ever have. I was pregnant again. So I made my booking appointment, I went to see my GP, and I was being told that you could have midwife-led care, you could have consultant-led care, I would have to go through an obesity test, I would have to have all these things done, and I said, but how does this impact my Ehlers-Danlos syndrome? And the doctor's exact words were, well, now you have no choice. I was then sent to see this consultant in Manchester because at the time there was no one in Liverpool who could deal with my condition. So I went to see the consultant and I sat down and he said, basically, you're going to do what you're told for this pregnancy. Now, I was 29 at the time. I was a first-time pregnancy. I didn't know what I was doing. So I went along with this consultant and I'd done all the things. I had the blood glucose test done. Because I was obese, it would come back high. I didn't even register at the highest point for a normal insulin person's level. I was told you'd have high blood pressure. My blood pressure was still low even at 9 months of pregnancy. So I went to see the consultant. I had all the usual checks done. I had to have a medication review, which I knew would happen because some of the medications are harmful. So as I sat there, the consultant told me what I had to do: go and see him every week, have growth scans every week, change your medication. If it makes you feel a bit low or you start to dislocate, well, you'll have to deal with that because that's part of my condition. I can dislocate. In the end, I went on to have my oldest son, Lewis, at 5, after being told I would have a long labour. I was in labour for 2 hours, start to finish, no pain relief, no medical intervention. I did suffer a second-degree tear, which, as I went to see the GP for my 6-week check, was never checked. I didn't know I had to ask for it to be checked. But I had my little boy. And then from that, I got involved in Seaforth Children's Centre. And in there, I met Betty from Sefton CVS, and she said to me, I know you're pregnant again, but would you be involved in joining a maternity services committee? So I went to the first meeting not really knowing what I was going to expect, what to do. I didn't know a lot about maternity because I don't know the English systems. However, I went along, and from that very first meeting, and one midwife saying, but you do have a choice. You may have limited choices, but you do have a choice. So when I next went to see the consultant with my second child, and they were saying, right, this is what you have to do, I said, no, I don't have to do that. You do not have to tell me what my pregnancy is. You can give me safe choices for me to make. So from that, I had an even easier second pregnancy, whizzed through 9 months, got to labour, and again I was told you'll need assistance, you'll need pain relief, you'll need 25 minutes I spent in labour with my second child. He was that quick. I was in the shower thinking, oh, it'll be ages. He was born in the shower. My husband caught him. Not prepared one single little bit, but he was born in the shower. But from that, my passion for maternity grew. I joined the MSLC, and I've been doing it now for 4 years. It's enabled me to take my one bad experience and say to people, no, you don't have to be dictated to. When you go, you are given choices. You may have a limited, reduced amount of choice, but you fight for your choice. This is your pregnancy, not your consultant's pregnancy. When I think that my son was diagnosed with Asperger's, SPD and dyspraxia, I questioned, was it because I didn't challenge a consultant? And it took me a good 18 months to believe that it wouldn't have mattered. But that one consultant came up in my mind 5 years later, doubting my ability as a parent. Did I not challenge? So if you can enforce one thing in any woman, tell them that they have choice. Through the MSLC, we've done a lot of things around tongue tie. We've looked at the 6-week check and trying to influence NICE with the new guidance on the check. However, I would urge you that if you have anything that you want to bring up, seek out help, seek out your MSLC, seek out Health Watch, go to PALS, go to all these places that you know you're going to get the help, the support and signposting that you need. But from this, in conclusion, the thing I'd like to say is take your positive example and embed it into practice. Take your negative experience and help to shape and make a change. Use your voice to challenge both good and bad practice and make this as much as possible your maternity experience, and where you can, help to shape things and leave yourself a legacy.
Hiya, I'm Kim. I have lucky enough to have two very healthy boys, one who's 5 and one who's 9 weeks old, who's over there in the audience, being good so far. If he starts wailing, I'm really sorry. I had my 2 boys at 2 different hospitals and had 2 completely different maternity experiences. My first pregnancy was very plain sailing. I was 28, young, fit, healthy, great, and it was all lovely until I came to labour. I was 42 weeks, I had to be induced, he just wasn't going anywhere, and all went fine. Well, it wasn't fine, it was horrific, but I had lots of pain relief, epidural, etc. During pushing, Noah, my oldest boy, his heart rate started to drop. The hospital reacted to this really quickly, all run in. He was born by ventouse, so I had to have an episiotomy. He was healthy, he was fine. I then started to hemorrhage. I lost a very lot of blood to the point where my iron levels were 5.7 post-birth. At this point, I should have been admitted to HDU for a blood transfusion straight away, and I wasn't. Due to lack of staff, I was put on a ward, just left. Eventually, the doctor came and told me I would need a blood transfusion. This took 2 days to happen. The first lot of blood went through, fine, first unit. The second one, the cannula had failed by this point. I'd waited so long, it just got thrown in the bin. So I never really had my 3 units of blood. By this point, it was 6.7. I never got another unit. I was left to go home, stitches, the rest just home to look after my baby. So try and get returned to normal, but then it all went wrong again. This isn't related to pregnancy, but it is about medical care. While I was pregnant with my first boy, I got a lump on my leg, quite a sizable lump. I went to the doctor and the midwives who all kept telling me it was fluid due to pregnancy. You're pregnant, you'll get fluid, it happens. At my 6-week check, this lump was still there and had grown and grown and grown, and it was quite large now. The GP then told me, you've got Rufus knee. Never laid a roof in my life. I have no idea why I had, otherwise known as housemaid's knee. Again, I don't clean. She then said, I'll refer you to orthopaedics, it's fine. Okay, non-urgent, etc., etc. 6 months later, I eventually saw an orthopaedic doctor and was diagnosed with a sarcoma in my left leg. I don't know if many of you know that's cancer. They then, at this point, my little boy was 6 months old. So I just got used to being a mum. It was lovely, and it all, my world was turned upside down. They were going to amputate my leg. So I remember, it's quite sad now when I think about it, I remember practicing making his bottles, hopping around the kitchen, because that was the only way I knew I'd handle it with one leg. I was very lucky to be able to, with the amazing work of the sarcoma team, I managed to keep my leg. I had lots of reconstructive surgery though, so it did leave me quite debilitated. After 6 weeks radiotherapy, I went for a routine optician's appointment and was diagnosed with a melanoma in my left eye. So before my baby was 1 year of age, I had 2 lots of cancer. I lost my left eye in December of that year, and again had to learn how to look after my baby all over again. I can't fault the care there either over at Clatterbridge. They were amazing. You know, they look after you so well. But I can't help but think, had the midwives and people picked this up earlier, it may have been different. My leg maybe wouldn't be the way it is now. I still have it. I'm very lucky. But it's, you know, doesn't work very well. So then, as you can imagine, I never wanted any more babies. That was the end, no more babies. But my husband convinced me 5 years later it would be lovely to have a little brother or sister for Noah, so we did. I was really anxious, as Grace was saying before, the fear of getting that positive pregnancy test, because although the doctors had said to me none of my cancers related to pregnancy, in my mind it just did. It was just too linked for me. So I was absolutely scared to death of having another baby. But so far, pregnancy went well, I dealt with it. Because of this anxiety, I was referred to the mental health team, who were brilliant. They kept a close eye on me all the way through. And then at 28 weeks pregnant, I was diagnosed with gestational diabetes. A lot of people were like, oh no. So I can't eat chocolate. But the absolute level of care that I got from that point on was amazing. I can't thank them enough. One of my doctors is here in the audience. I won't mention it, Dr. Bird. From that point, it was brilliant. Every appointment I'd go to, there'd be 2 obstetricians, a diabetic doctor, a diabetic nurse, a midwife. I don't get that level of care at cancer appointments. It's honestly, it was amazing. I was listened to all the time. I'd tell her how anxious I was. She just kept telling me to shut up. I'm never doing this again. You will. I won't, I promise you will. And she was brilliant. And, you know, we were going to call our baby Alice if it was a girl, but it wasn't. It was a boy. But they were great, and completely different experiences between the 2 hospitals. And I don't really know what was so different, except they just seemed to care. And I think that's one of the things, is that just listen to the people, what they say. If they're anxious, don't tell them to shut up and get on with it, because to that's very real. That's someone's very real fear, and it, you know, dominates a lot of their life. I went on to have, I was induced again because I just don't like to go into labour. It took 4 days, didn't happen. So on the 5th day, my little Toby over there was born by caesarean section. I had such a different experience, and I probably would do it again, even though I swore I wouldn't. But I just wanted to be part of this day, really, just to share that. Just to let people know, people come to you with a problem, don't disregard it as pregnancy. It's just pregnancy. Sometimes it really isn't. And luckily, I'm still here 5 years later, all clear, but it could have been a very, very different story. And my boys, well, not this one because I wouldn't have had him, but my first boy would never have had a mum to watch him grow up. And I'm very grateful for that. So, yeah, if this can just help improve one thing, then that's why I wanted to be part of it. So, thank you very much.
Well, thank you very much to Kim and Monica, both brilliant that you've shared your stories with us. I'd now like to welcome Nikki Lyons up. She's a patient rep for us in this area, and she's actually been very instrumental in making this review happen. So without further ado. Sorry. We're going backwards, aren't we? Sorry, we will be with you in a second. Here we are.
It's in the middle of the right hand one. Just press the hand. Well, hello, my name's Nikki Lyon, and I'm here to talk about my son's birth. Back in April 2013, the CCGs were newly set up, and I actually met with Simon Banks and Clifford Richards from the Halton CCG, and I wanted to talk to them about the maternity service they were commissioning. I wanted to know, how did they know the service they were commissioning was safe? And also, what information was there for mothers to make a really informed choice about their pregnancy and where to have their baby? Why was I asking? It had nothing to do with healthcare as a profession. Well, actually, the story starts 5 years earlier, back in 2008, when I was expecting my first baby. I was a healthy 35-year-old, married to Mike, and after a very long wait, was happy to be expecting my first baby. I had no problems during the pregnancy and did everything I could to try and stay healthy. Oh. Okay. So, the Friday afternoon, I had my 10-day overdue appointment because nothing had actually happened. I went into labour later that day, the Friday tea time. Went into hospital when advised, and I thought, this is it. After all this waiting, I'm going to have my baby. We're going to get home. And actually, going into hospital was the first time I thought, this is now real. We've got here. But I'm sorry to say the midwife wasn't very welcoming when we arrived. She didn't ask to see my birth plan. Really didn't communicate very much. She left us alone for long periods and didn't even tell us how to call for help if we needed it. I was put on continuous monitoring, but didn't quite understand why. My husband kept asking, why is the heart rate dropping? Because he could see the number on the machine. And she just kept saying, oh, that's normal, that's normal. But it did keep dipping lower and lower as time went on. The registrar was called eventually to have a look what was happening, and she asked the midwife to try, to start with fetal scalp electrodes to check the heart rate. However, the midwife didn't seem to know what she was doing and didn't ever manage to actually get those attached. She gave up in the end. Registrar then came back and decided to do a fetal blood sample, which came back just above normal. Still, we got really very little directional support and were left on our own again. Now, people say, well, why didn't you ask? In fact, I was asked about last week this when I was talking about it. Well, you know, why didn't you ask for a second opinion? Why didn't you get someone else? Well, we're both quite confident people, but I was in the throes of labour. Mike was trying to support me, and we felt vulnerable. It was the middle of the night. There wasn't many people around. It was very dark. Even in the corridor outside, I remember it looked very dark. And who were we to assume that we knew better? Who were we to assume that we knew more than them? So we put our trust in them. What else could we do? When the registrar came back later, over an hour later, I remember looking at the trace and it looked like she'd seen a ghost. I could see on her face how bad things were. She just said, we need to get this baby out now. When Harry was delivered, there was some doctors in the room, paediatric doctors, and I didn't get to see him. He was taken straight to the resuscitation table. I just lay there while I worked on Harry. I didn't know if he was a boy or a girl, and just tried to block out what was happening. Actually, Harry pulled through and he was taken to neonatal. He was 8 pounds, 10 ounces, and he had been a healthy boy, but was now fighting for his life. Here he is. The biggest baby on neonatal for sure. He was ventilated, but actually started breathing independently quite quickly. I was willing him to be okay. It wouldn't be possible that he couldn't be okay. And I didn't understand how a term baby and a healthy pregnancy, the fact that we'd got to hospital, I didn't think this could be possible, that a child could be this poorly, so I didn't believe it was true. After 24 hours, he started to have fits, had to be sedated, and had to be ventilated again. I was in utter shock. It seemed impossible that our so longed-for baby was now critically ill. He was being fed through a tube, and when he came round from the sedation, he was very, very unsettled and in distress. When he was 4 weeks old, the consultant told us what I think my husband had known from about the time he was born, but that I wouldn't believe, but told us that he had profound brain damage and that he wouldn't ever walk, talk, or be able to feed normally. We were heartbroken. Our lives were up in the air. We just didn't know what the future held. And I don't know how to put it into words because it's hard to describe the anguish and upset that we went through. Actually, what added to the upset was that no one really wanted to talk to us about what had happened. We were asking questions, but no one would speak to us. So we put in a formal complaint about the care, and 5 weeks later got a very long, well, actually 6-page letter back detailing the errors that had taken place during Harry's birth, and the fact that NICE guidelines hadn't been followed. The hospital also admitted that Harry should have been born sooner by C-section, although they didn't admit at the time that the errors caused the injuries to Harry. A few weeks later, Harry had an MRI scan which showed that the brain damage had happened right at the very end of the labour. So I hope you can see that, but there was obviously, or the hospital undertook an investigation. On the left-hand side is what came out from that investigation. I feel that did describe what went wrong, but my question was why? Why had those things happened? Why had those mistakes been made? Because to me there was something more underlying. The conclusions I came to are definitely the fact that it was out of hours played a big factor in what had gone wrong. I do think if my son had been born during the day on that Friday, the outcome could have been very, very different. I feel for the staff because I think the staff were rushed. And out of hours, there isn't a consultant usually on site, which I think did have an impact in my case. Also, the fact that internal investigations are often done with no one independent involved means that no one is actually looking independently at what happened, and also that learnings from these cases aren't necessarily being passed on. I believe that some of those errors on the left-hand side must have happened before, and maybe even were happening regularly, but tragically for us on that night, all those errors lined up. For those who know about safety, the Swiss cheese model, I think, is exactly what happened on the night when Harry was born. And possibly, if some of those errors had been picked up sooner, that they were happening, some of those things could have been fixed and they wouldn't have all lined up on our night. Later, and quite a bit later, I started to wonder how unlucky had we been and how many people across the country did this happen to. And no one could tell me. I wrote to the Department of Health, I wrote to NHS England, and actually no one could give me that answer. They could give me little bits of the answer, but not overall how many children die or were injured due to problems in labour. And some years later, quite a lot of years later now, we are starting to get to a number. Okay. Each baby counts now as estimated that 1,000 term babies each year either die or are left brain damaged due to problems during labour. And behind this statistic is large variations in practice, care and outcomes. And also some reports have shown there are more dangers out of hours. There is more risk of your baby being left brain damaged if it's born through the night. And that's even when you take away those planned deliveries. During pregnancy, you talk a lot about Down syndrome and those sorts of risks. And actually, once you get through those tests, you think, oh, well, that was the risk they were talking about. Everything must be okay now. But do we talk about the risk of this happening, which is actually a lot higher than you think? Okay. A little bit about money, because I know money is very important. But here's the figure. We spend £500 million a year on litigation. I think it was Catherine's presentation, litigation was mentioned. Wouldn't it be wonderful if actually that money was available to you guys up front that then would hopefully stop the problems and then would give great outcomes for families, and also the litigation wouldn't be happening. This is all in addition, obviously, to the human cost of these incidents. There's also huge cost spent in looking after children like Harry. I estimated just his care through his first year was probably about £200,000. That could get quite a lot of care on a maternity ward. I know these cases are actually the small minority. However, these are real. I'm living proof of that. And labour doesn't stop. That's why the care at the time is so important. You can't press pause. And after Harry was born, I kept saying, I wish I could press pause. I wish we could go back. Labour is a moving train. There is no time when these things go wrong. Okay, you might be wondering about Harry? Well, he soldiered on. He was amazing, but he did have a very difficult life. He was fed initially through his nose, but then had a gastrostomy and was fed via feeding pump. He was sick often each day. He also had some fits and was often uncomfortable. He was on 23 doses of medication each day, which we measured out and gave to him. But he was a beautiful boy and did smile and gave us a lot of joy as well. The team around Harry was big. This is my living room, by the way. It sort of turned into a bit of a mini ward at times. He had a paediatric consultant, 3 other specialist consultants. There was community nurses, physio and occupational therapy. So you can see how that money builds up in terms of his care. When he was 15 months old, he started having a lot more secretions, and these caused him a lot of problems. We started having to use suction in his mouth more often, and eventually had to do some suction down his throat as well. He did have choking fits, and it was very distressing to watch. At the age of 18 months, he developed a chest infection and was taken into hospital and went downhill over the next 4 days and didn't respond to treatment. We actually made the decision not to ventilate him because we thought his quality of life was generally so poor. I can't describe how hard that was. Oh. Harry died on the night of Friday the 6th of November 2009. And really, we carry this with us all the time, and I can only describe this as we will no longer be carefree again. You know, we carry what happened with us and the sadness of losing Harry. So why am I here? Well, sometimes I do wonder why I put myself through what I do. And I'm not here to make anyone feel guilty. I'm not here to scare people. I'm not here for pity. But I just want to remind people of the consequences of poor care. And I want to campaign for the best outcomes possible, with safety at the foundation of all care, the correct funding, the correct staffing, the correct equipment, training, procedures, and learning from mistakes and being honest with patients as well. So I guess my message is, if you're a commissioner, do you know you're commissioning a safe service that's following the guidelines and achieving the best outcomes? If you're a hospital manager, are you supporting your staff to really do a great job? And if you're a clinician or a midwife, are you following the best practice? Are you discussing risk? Are you being open and honest when things go wrong? I hope this initiative delivers a great service for families, but most of all, I hope it delivers a safe service. Thank you.